get started here, there's a couple of folks that haven't shown up yet, so we'll have to just wander in. I'm Dr. Paul Connor. I'm one of the cardiologists from North Cascade Cardiology, and I have a bent or focus in preventative cardiology and heart failure, and so it's the preventative piece of it that kind of come to talk to you guys about tonight, and a special topic area of more burgeoning importance as we've kind of looked at this over the last decade of women and heart disease. And so, without further ado, everyone's cell phone is turned off, I hope, or on vibrate mode to kind of not disturb your neighbor if they go off. So, if I can get the slide thingy to work. So this is what, heart disease has looked like for the last 50 years, right? What our image of heart disease has been, the fella getting home from work on his cold, dusty trail home from work there and suffering a big heart attack and winding up in the hospital. And we've seen this in countless images across TV and movie and Trapper John MD. I'm probably dating myself on the TV show there, but those kinds of things. And the historical perspective of that, in the 1960s, the American Heart Association had a conference, and the conference was entitled, How I Can Help My Husband Cope with His Heart Disease. And so almost all the studies that were initially done were done more or less strictly on men, because the recognition really wasn't there that this was a big player in women. And to be fair, at that time, it was a little bit of a less of a player because some of the things that we're going to talk about were a little less affecting women at the time, the 1940s and 50s, that have really kind of roared into the presence for the 1990s and 2000s. Right now, believe it or not, coronary disease is the #1 killer in women. I mean, we have the tremendous amount of media attention to cancer and the effect that cancer has in women. But if you add all the cancers together, they still don't kill as many women as coronary heart disease does. It's the second leading killer in young women aged 45 to 55. And a third of all death of any kind comes from cardiovascular causes, whether that be stroke or heart attack. And that's pretty much 1 in 3 women will die of coronary disease, where only 1 in 25 women will die of breast cancer. And one of the big reasons that we've kind of gotten to this point where, for all of us, the coronary disease has become just such a front and center item is the last one you see there. Diabetes and obesity has just become a devastating, terrible kind of affliction on the whole society. And unfortunately, it's disproportionately affecting women more than men. We have, here's the third slide, you can see the death or mortality trends, and in blue, sorry the colors don't come out real well on the slides here, but in blue is the downward trend here, if I can maybe highlight it for you. This is the death rate for men from heart disease, and this is the years down here, 1980 to 2004, and you can see a nice linear reduction in the death rate for men. And unfortunately, here's the death rate for women. It actually spiked up here for a period. It is coming down a little bit now as we've had much more recognition of this problem, but that's just an unacceptable disparity between the sexes there. The causes of coronary disease in general are the same for men and women. It's basically a buildup of fatty plaque. We used to think of these fatty plaques as kind of hair in the drain, and it got clogged up and flow didn't get delivered to the muscle. But we know now it's a much more dynamic process. These fatty plaques aren't just a clog, they're an active process where the white blood cells get activated, they draw in fat from the circulating blood, and they start to actually inflame the artery walls. We hear a lot about inflammation in coronary disease. That's where the ideas about gingival disease or gum diseases come into play, or people with rheumatoid arthritis or other inflammatory arthritises, how they can impact coronary diseases through that process of inflammation. And this slide just goes into the detail of how that goes about. And so here's your heart on a CT scan. The little snakes or roots of the tree are the arteries that actually sit on the outside of the heart. And so your heart muscle gets supplied all of its oxygen and blood supply through those little root systems. And what happens is they can ultimately start to develop fatty plaque and blockage. And so here we have a nice normal section of artery if we were to just cut an artery in half and look at it. And here we have the beginnings of a fatty plaque, kind of represented with this typical yellow appearance that you think of as chicken fat. And again, we used to think of, oh, it's just filled with fat. But when we really started looking under the electron microscope at some of these plaques, we see they're just laden down with cells, white blood cells. We call them foam cells when they get to this stage. They're white blood cells that you think when you cut yourself and you get a little skin infection, you see that pus in there. That's white blood cells. Well, it's the same kind of cell that comes to these areas of fatty plaque and chew up the fat. Well, that's great that they chew the fat up, but unfortunately one of the byproducts of that is they start to dissolve the artery. So as they chew the fat, they dissolve the artery, and your artery becomes weaker. And over time, that weakening allows small cracks and fissures to happen on the inside of the artery. And ultimately, those cracks and fissures can rupture, and that's what a heart attack is. When they rupture, the body sees that as a bleeding problem and starts to form a blood clot around those cracks or ruptures. And when that blood clot forms over the fatty plaque, no blood gets delivered to the tissue beyond. And so that muscle starts to die. And that's what a heart attack is, scar tissue development because of a lack of blood supply. And so we can see much more dynamic, much more cellular than we ever thought of as far as just a simple clog in the drain. And here's what we do as heart doctors. When you come in with a heart attack or chest pain, we take you to the heart cath lab many times. And here's our little catheter, this white line here. And this is putting X-ray dye into the arteries. We see this artery here is nice and normal. It goes all the way down. It's nice and smooth. And then this artery here just comes here and stops. There's no artery beyond there. That should come all the way down here. And so that's a heart attack. That's where the blood flow stops. So all this tissue that's being supplied is not getting any blood flow whatsoever. And so what we usually do, I'll show you, is what's called an angioplasty or a stent to try to open that area up. And the usual risk factors we all probably know about from the media and hopefully from our physicians as we go to them, but just to kind of review them one more time for everyone. Of course, age brings heart disease, and it does still happen to women a little later than men. We start thinking of increased risk for men at 45 years of age, and for women about 55 years of age. Of course, cholesterol is still one of the biggest things that we worry about. And here we have some numbers, and these are always a moving target. Depending on what your cholesterol number, what your risk factor is, your cholesterol goal may be different. So someone with diabetes, we used to say, oh, well, if you get below 130, you're good on the LDL. But we really think now, probably if we can get you down below 100, and if you have active blockages or heart attacks, we actually want to drive this LDL number down to 70. There's been several big studies that have shown about a 25% reduction in recurrent heart attack in those folks that we can get their bad cholesterol, the LDL, down below 70. But we also know the good cholesterol, the HDL, needs to be high. The HDL functions by picking up fatty plaque from the blood vessels and bringing it back to the liver so you can eliminate it. They're kind of the trash trucks of our body. So if we don't have enough trash trucks, we build up too much trash. And so that's why low HDL is as important as high bad cholesterol. Diabetes clearly is hugely important in the development process. It speeds this whole inflammation process up, puts almost a 10-fold increased risk in people if they have diabetes compared to non-diabetics. Blood pressure, we've known for a long time, increases the strain and stress in these blood vessels, which also accelerates this whole process. And again, getting back to some of the more modern problems of obesity, sedentary lifestyle, also causes inflammation. We're built to move. We're animals and not plants. And so we know that as we become more sedentary, we drive to more places and walk to less places, that our cells become more inflamed. We have more exposure to insulin. We have more exposure to high fat circulating in our bloodstream, and our bodies become more inflamed in general. And so the sedentary lifestyle and obesity that accompanies it with it has what they think now have almost a 400% increase in coronary disease over the next 5 to 10 years. Of course, cigarette smoking is hugely important for a whole host of reasons. It causes spasm in these blood vessels. It causes blood platelets to stick together to form blood clot. It causes acceleration of these fatty plaque buildups in the artery wall. And then your genes matter a lot. If you have a first-degree relative, either mother, father, brothers, or sisters that have had coronary disease, your risk also is substantially increased because of the genes that you share with them. And then last, the newer recognition of something called the Metabolic Syndrome, which can be thought of kind of as a pre-diabetes. You don't have full-blown diabetes yet, but you're getting close. That's this metabolic syndrome. And again, that's a substantially increased risk compared to the general public. So again, on the rise, these risk factors are in 1970, when people did a lot more bicycle riding and walking, and they didn't have all the indoor malls that we have today. There was only 1 in 4 people that had one of these risk factors, and today nearly half of us have one of these risk factors. A tremendous change in just 30 or 40 years. And they think these 4 risk factors account for almost 80% of stroke and heart attack. I mean, let's really think about that. That means there would be 80% less stroke and heart attack if we got these 4 risk factors under control. And this is one of the more sad kind of statistics right here. 1 in 4 children between 12 and 18 years old are now either overweight or obese. Again, from high caloric diets and high caloric sugary drinks and that kind of thing, and lack of activity. And this is just a slide demonstrating that whole 80% of the risk coming from these risk factors. So let's talk about women-specific events that happen and contribute to heart disease separate from the general risk pool that we've just talked about. So these are the issues around women and heart disease. They do some things that men don't do, menopause and pregnancy primarily, but they also have a more intense reaction to the risk factors that are out there, and we'll go through that in some detail here. Birth control pills also increase our risk of blood clots and therefore increase our risk of both stroke and heart attack. And then lastly, the role that many women find themselves of caregivers many times causes them to defer their own care, and we see that actually statistically borne out. That's not just anecdote. When they've looked at that in studies, women present later to their doctors with complaints. They minimize their complaints when they present to their doctors, and they're less likely to take the advice of the doctors for either testing or medical therapy. So here again is another schematic of the actual growth of our risk factors in general. This isn't women specific, but we see obesity here. The lighter is the good color. You can see here less than 10% is the gray for obesity, and as you get redder and redder, it becomes closer to 25% for obesity. 1991, 2001, they don't have the 2011 slide out yet, but from what I understand, almost the entire thing is red. And then here's diabetes. Again, we don't want to be red, we want to be gray or white if possible. And again, we've had tremendous progression here, just in 10 years. And then here's what it looked like for diabetes in 2007. And then all this whole area is greater than 10 to 15% diabetes rate. So what about women and diabetes? Well, here we have men and women compared together. We have the darker is the men and the lighter shade is the women. And women with diabetes and men with diabetes, look at their death rate. Their total death rate is almost 30% higher in women than it is in men. Their heart failure rate is almost 50% higher. Their peripheral vascular disease rate, where you get blockages in the arteries to the legs, is about 300% greater. And your risk of heart attack, again, is about 50% greater. So same risk factor, men versus women, substantially higher risk in women than in men. And then here's another way of looking at this, the trends of diabetes. And again, here's men, here's women. Here's men dying of their heart disease, both with and without diabetes. And look at this, this is nice. This is 1970 to 2000. We've lost almost about a 40% reduction in people dying of their heart disease if they've got diabetes here as in men. Well, look at this. This is the women. It's terrible. Straight across the board, no reduction in death rate. And that's death rate. That's not just heart attack rate or recurrent stroke rate. That's people dying. And so that's just a telling tale of what's going on here with the way that women react to their situation. And metabolic syndrome, that pre-diabetes that I talked to, again, also lowers your survival rate over 4 years. Obesity and physical activity. More adult women and men are obese and sedentary. And obesity and physical inactivity independently contribute to your death rate, as we've talked about. With lipids, not only is the LDL important, but the HDL, as we talked about, and something called triglycerides, which come more from starch. They seem to be much more important in women than they are in men, so it's a threefold attack against women's arteries as opposed to a more one- or two-fold attack for men. And hypertension is also a huge element. it doesn't really affect men or women